Well, good morning. Hello, my name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. We're excited that you've joined us today for the Song Brown Family Nurse Practitioner, Physician Assistant, and Certified Nurse Midwifery Informational Webinar. Before we begin, I want to make sure that everyone knows who this webinar is for. Today's webinar is for new and continuing applicants to the Song Brown Family Nurse Practitioner, Physician Assistant, and Certified Nurse Midwifery program. These programs provide grant opportunities that will result in funding for organizations to educate and train providers in these professions to work in underserved communities. I want to note that we will have a separate application for licensed midwifery programs coming up on October 24th. So be watching our website and your email for the webinar registration for that. Today's agenda, I'm going to do some housekeeping and introduction at the beginning, and then I will be introducing our program officer to go over the updates, application process, and requirements. Then we will have a time for question and answer at the end. And lastly, before we begin, let's discuss those housekeeping items. Number one, our webinar is hosted in Microsoft Teams. If you are not familiar with the platform, you can find the view controls and the chat feature in the menu bar at the top of your screen. Today, the chat option will be open for asking questions during the Q&A session, which is at the end of this webinar. And number three, the webinar will be recorded and posted on our website in approximately 7 to 10 business days. The slide deck and resource links are also posted in the chat right now, and you can access those. And with that, it is my pleasure to introduce Castanine Naval, Song Brown Program Officer.
Thanks, Chris. Good morning, everyone. My name is Castanine Naval. I am the Program Officer for Family Nurse Practitioner, Physician Assistant, and CNM. Before we begin, let's talk a little bit about Song Brown. So as Chris mentioned, we do provide award incentives for programs that graduate individuals who practice in medically underserved areas, enroll members of underrepresented groups in medicine to the program, and locate their program's main training sites in medically underserved areas, serving patients who are primarily Medi-Cal recipients. As well as nurse practitioner and physician assistants, we also provide funding for registered nurse programs and primary care residency programs and certified nurse midwifery programs. And brand new this year is the licensed midwifery programs. All right, so our application dates here. So it released September 26th last week. Early submission deadline will be October 29th, 2024 at 3 p.m. If you submit your applications before October 29th, we will do a review of your application and provide some feedback. Anything submitted after October 29th will be considered a final submission. The final application deadline will be November 12th, 2024 at 3 p.m. So a few things to note before you apply. If you do have a authorizing body for contracting, make sure to inform them of the terms and conditions of the grant agreement outlined in our grant agreement templates in the grant guide on our website. Make sure to read through all of those terms and conditions as you will have to approve and agree to them prior to accepting awards if you were to be awarded. We do not make any changes to terms and conditions specified and outlined in that grant agreement, and funding shall be used to expand primary care services and does not supplement existing federal, state, or local funds to provide primary care services. Some changes in the FNP, PA, and CNM cycle this year is we did do a complete scoring criteria change for all applications. I will get into greater detail on that in the final section of this presentation. I'll provide some scoring numbers and totals and some scoring methodology explanations there. There are now separate applications for FNP, PA, and CNM. So if you are a CNM applicant, you do have your own application. So make sure to select the correct application when applying because they are separated this year. Student race and ethnicity data will only be collected in aggregate. We do not need to know student names, just aggregate data, race and ethnicity, and we'll go more into that later as well. And this year, we have limited the number of training sites that we are asking for. So we are only asking for up to 5 training sites with the highest cumulative hours for all students in the previous academic year. And we will also be asking for the organizational NPI number for each of those 5 training sites. Some information to gather I really want to emphasize and highlight here is that we want to make sure that your organization name and or doing business name as is accurate to what is said on your W-9 IRS form. So when you are completing your application, please make sure to look at your W-9 IRS forms to get the accurate name, organization, and DBA if applicable, as well as the address for your institution that is listed on your W-9. That will make sure that your payments are going to the correct place and everything is going to be listed correctly on your STD-204 forms. You will need a authorized grant agreement signatory and a payee data record signatory or STD-204. Those are the things that we want to emphasize here is W-9 IRS forms will be your best friend when finding the correct information for those documents. You will need the names and full addresses of the 5 training sites, as well as the NPI number for those training sites and the facility type for those training sites. For students, the only thing you need to gather information for is the race and ethnicity. Your graduates, we will need their current practice site information as well as their NPI numbers. As for documents, for FNPs, you will need your approval letter from the BRN. For PAs, you will need your ARC-PA letters. And for CNM, you will need your ACME accreditation letter as well as your approval letter for expansion slots. So if you are applying for expansion, make sure you have your approval letter for those expansion slots listing how many slots you are approved for. So some helpful resources, we have both of our grant guides, the FNP and PA and the CNM grant guides on our website that will list all of the terms and conditions, everything you need to know about the grant, as well as some sample templates for the grant agreements that you can reference to if you need to get those approving bodies authorization to apply. We also have the Song Brown glossary that has all the terms. Sometimes things can be a little confusing, but we have all the terms defined for you in the Song Brown glossary, also on our website. So some helpful tips to navigate the application. So there are 2 main buttons that you're going to see at the end of every page. That is the previous button and the save and next button. Previous just navigates you back if you need to go back to a different page. And then save and next is very, very important. Anytime you fill out information on your application and want to move on to the next page, or if you need to put your application on hold for now and come back to it later, make sure to press save and next so that you can navigate back to that. Save and Next will also make sure that your applications are stored in the Grant Applications tab on the funding portal. You'll go to Grant Applications and then find your corresponding program, FNP, PA, or CNM. They will be separated once again. And you can always go back to your application to edit or add or finish. So you will have some asterisks. You'll see them throughout the entire application next to the text fields. That just means that that is a required field and you cannot move on from that section until that is completed. You will also see some blue circles with white question marks. That is our tooltips. It provides more information about what we are asking for in that field. So now let's go through the FNP, PA, and CNM application. This is a step-by-step, page-by-page walkthrough of the application. I'll tell you about what we're looking for in each page. CNM will have a little bit of a difference, and I'll show you those differences in the next section. But this is a page-by-page walkthrough. So your first page is going to be your program information page. I want to highlight here this top portion of your program information page will be pre-populated directly from your profile. So if that is not correct, you can navigate out of the application, go back to your profile page and change the information that you need to change. And then come back to the application and it should pre-populate correctly up here in that top section there. For FNP and PA, you will have the option to go through the FNP path or the PA path. Just select which one accordingly. If you are a returning applicant, you just need to look for your training program in that magnifying glass next to training program title. you can search in the search bar for your program, and if it does not pop up, there is the option to do training program not listed. You check that off, and you can enter all the information for your training program accordingly. The next page is the contract administration page. This is where your W-9 IRS forms will come in handy, so have it by your side when you're filling this out. This is where you're going to insert your contract organization name and your doing business as name if needed. It must match that IRS form, so having it next to you will always be good. You also need to list your correct entity type, so governmental or non-governmental entity. Your contract admin is the main administrator for your grant. They will be the person handling the grant. So you would put that there in that next section right below DBA. Your grant agreement signatory will be the authorized individual who will sign all of the grant documents. So you want to make sure that their information, their name, email is spelled correctly, because their email will be sent the DocuSign package if you were to be awarded the grant. That goes for if you are having a different STD-204 signatory to your grant agreement signatory. You'll select no on this first question here, stating that you have a different signatory for STD-204. And like the previous signatory, just make sure that their first, last name, and email are spelled correctly so that they get the documents if you were to be awarded. The next box, their next section would be the address that your payments will be remitted to. Make sure that matches your IRS form. If it is a PO box, there's an option to make insert a PO box number on there. And then if you have a different remit to address for the payments, then it is on your IRS forms. There's also a section down here where you would select and enter that information. So program description, this is your chance to tell us about your program and how it meets the mission of Song Brown. You have 2,500 characters to insert here. It will give you an error message message to tell you that you've reached your 2,500 characters. So if you are typing it up in Word doc, for example, and you paste it over, just make sure that it is at that 2,500 character limit, telling us all about your program. The next page is the program data page. We will be looking for 22-23 and 21-22 graduates. And if you have graduates for either or both of those years, you will select student and graduate data. If you have no graduates for 21-23 or 21-22 and 22-23, you will select student data only, and you will only have to put in that aggregate student data. Based on that program you selected, what year did you enroll your first cohort of students is the next question here. So you're just going to put the year that your first set of students enrolled into your program. Next is our training site page. So like I mentioned earlier, we did reduce the amount of training sites that we are asking for this cycle. So we are asking for a maximum of 5 training sites, primary care training sites within the state of California, with the highest number of cumulative hours of student training. So it lessens the burden on you to give us all the training sites that you have had students train at during the school year, but also it just lets us know which training sites you have. So 5 is the maximum, 1 is the minimum, as long as you enter 1, and this is that page. So to navigate this page, you're just going to add site. You have some edit options here. So these little arrows next to the training sites will say edit or delete, and you can change your training sites up until you submit. Next page will be this is the pop-up that happens when you press add site. We are asking for facility type for your training sites this cycle. So if you want more information on those facility types, what kind of facility types your training sites fall under, we have a more information button here that you can select. Each facility type also has that tooltip next to them for more information on the facility type, so you can verify that that training site falls under that facility type. And you can select more than one if it corresponds to more than one facility type. We are asking for the cumulative hours for all students at that training site from the previous academic year, and you will list that there. Right below is that NPI number. There is a link to the NPI registry right next to that field. So if you don't know it off the top of your head, you can select the NPI registry button and it'll navigate you to the NPI registry website, and you can look up your organization from there. And the last portion of this training site will be the payer mix breakdown for Medi-Cal, Medicare recipients, mixed and uninsured. That is going to tell us what those training sites, what kind of payer mix that training site has. Next up is the program expenditures and funding page. This is where you're going to tell us how many slots you are requesting for this cycle. That will pre-populate and calculate here on this side, telling us the total funds requested. This next section here is going to inform us of what your previous academic year's expenditures looked like based on personnel, operating expenses, major equipment, and other costs. The total number here must be greater than or equal to this number here, just telling us that these are the funds that you're requesting and these are the funds that you used last year overall. Next is that new aggregate student data page. So this first section, you're going to tell us the general information for your students. So how many students is the capacity for the entire cohort? How many students applied, how many students are enrolled, and then the breakdown of your year 1, 2, and 3 students. From there, this total will pop up and you will enter that many students into the race and ethnicity sections in the sections below. This number total and this number total should be equal. If not, you will get an error message stating that you're missing a student or you have too many students. So it'll help you make sure that you have the correct number of aggregate student data. Next page is the graduate data. Here you will enter the 21-22 graduate number and the 22-23 graduate number. You will add your graduates and that pop-up will display. Just like the training sites, you do have the drop-down here to edit or delete a graduate. And that pop-up will look a little something like this. At the top of the pop-up, it'll be the name of the graduate, information about the graduate. And then here, if you know their NPI number, you'll select yes or no. If you don't know it, you will select no. If you select yes, this field will populate. You can also access the NPI registry and look for your graduate's NPI number on the registry as well and enter their 10-digit number here. We will also be asking for their practice specialty. So it will drop down and have a list of practice specialties on there for your graduates. And then if you know their training site within the state of California, you will select yes. If you do not know their training site or they are practicing outside of the state of California, you will select no and tell us why, whether it is out of state or unknown. And for your required documents page, I stated earlier the required documents for FNP, PA, and CNM expansion. You will enter that here in your approval letter. Make sure that the letter or the document has APPR underscore to be accepted into this upload. If you need a correspondence letter, if you want to upload a correspondence letter, you will want your document to be titled CORR underscore to be accepted into this upload. So this is just where you're going to upload any of your documents that you need and are required. You can upload as many as you need to, and it will turn green. So this will turn green as soon as those documents were accepted. If it does not turn green, then the title of the document, it does not match the APPR underscore. So just make sure it turns green and then you're good to go with your document upload. The last page of the application is the assurances. Make sure to read the statement above and then press I certify. The moment you press submit on this page, your application has been submitted and cannot be edited unless you have submitted prior to the early submission date of October 29th. So make sure to read and certify. If you're not ready to certify, if you're not ready to submit, you can go backwards into the application as needed. But once you click I certify and submit, it is submitted and you cannot go back. So I want to emphasize that you want to make sure that you are all done before submitting. All right, so these are the two pages that are different for the CNM application. So it will just be the program information page and the program expenditures and funding page that are a little bit different for CNM. Everything else, the order and everything will be exactly the same as FNP and PA. So for CNM, you will see an option for expansion. So it says, is your program expanding for the 24-25 academic year? If you select yes, these two fields will pop up and explain a little bit of what we are expecting for an expansion program. You will select those two checkboxes to move on, and just like FNP and PA, you will select your training program site or your training program title here, and so on and so forth. So the only difference here will be the program expenditure, or the program expanding question. And then the only difference for program expenditures and funding will be the CNM expansion slots. So you have up to 3 slots for program expansion for CNM that will calculate here as well. And same thing as FNP and PA, you will have this academic year 23-24 expenditure list. This number and this number should still be greater than or equal to. Now we're going to go into the scoring explanation for this application cycle. So for all 3 of the programs, this is the basic criteria and points for each criteria. So, and I also listed the e-application page that corresponds with the scoring criteria. So we are looking for the percent of graduates in areas of unmet need for 25 points. Percent of students in underrepresented medicine for 25 points, percent of main training sites in areas of unmet need, up to 5 training sites with the most cumulative hours for 25 points, and the average payer mix of main training sites for those 5 training sites for 25 points. So here are some examples of how those are going to be calculated. So for criteria 1, if you have 50 graduates and 20 of which are graduates practicing in areas of unmet need, then you have a percent of 40% of graduates practicing in areas of unmet need. To calculate that, we would do 0.4 times 25, the total number of points, giving you 10 points for this category. Similarly, if you have 60 students in your cohort or in your application, 30 of which are students in underrepresented medicine, then you will have a 50% of students in underrepresented medicine. That will give you 12.5 points towards this criteria here. The next one will be the training sites. If you have 4 training sites, 3 of which are training sites in areas of unmet need, then you have 75% of your training sites in areas of unmet need, and you will get 18.75 points for your training site criteria. And the last criteria for this cycle is the average payer mix. If you have 3 sites and these are their breakdowns, we will average your percentage of payer mix, and that average will then be multiplied by 25 to get 16. So for this particular example, you have 0.64% times 25 equals 16 points. So for this example program, they scored a total of 57.25 points out of 100 points. So that is the basic and simple breakdown of how we score this application cycle.
All right, thank you so much, Cassidy. As you can see, our team has put a lot of hard work into this program, and we're excited that you've joined us today to learn more. We're going to transition to our question and answer session, and the chat option is now accessible in the menu bar at the top of your screen. We do understand that some of you may not be able to access the chat feature in the browser version of Teams due to your organization's restrictions. Some find that the mobile version does provide chat access. If you're still unable to access the chat feature, please email your questions to songbrown@hci.ca.gov. Thank you for your understanding in that. We will be answering the questions in the order that they are received, and we will do our best to answer all the questions you have. So let's go ahead and head to the chat. And we got some questions already coming in. And Cassidy, you can go ahead and come back on camera, and we'll answer people's questions here. All right, first question. For programs without graduates yet, how is criteria 1 scored? Lose all the points or compensates?
So that is a criteria that we will need to look on case-by-case basis. So at the moment, our research team will need to kind of get more information on that based on your application. So I will get back to you on that. So if you could send us your email, I will give you a more in-depth explanation of what would happen if you have no graduates yet for your specific program.
All right. Thank you, Cassidy. Next question. Do we need to provide info for each graduate?
So you will need to give us their name. For this cycle, yeah, we do ask just for their name and then their practice site information. So first, last name, practice site information.
All right. And
Sorry,
see
Chris, and NPI. So if you know their NPI number, we also ask that as well.
Perfect. Thank you. And see your email there. Elias, thank you so much for that. All right, more questions. We've got plenty of time today to answer everybody's questions. I want to remind folks, we do have all of our links pinned in the chat. You can scroll up to the top of the chat menu or the chat bar, and you'll see the Song Brown resources, link to the webpage, the grant guide for each of the different programs, the technical assistance guide, our glossary, and then an email that you can contact us at songbrown@hci.ca.gov. Question is the deadline October or November?
So the early submission deadline is October 29th. If you want us to review your application and provide some feedback and then give you some time to edit your application, you need to submit it before or on October 29th. The final deadline for the application is November 12th. So once the October 29 date is passed, every application after that will be considered final, and the application will close on November 12th.
All right, great question. Thank you for the clarification on that, Cassidy.
And I do want to emphasize really fast because Chris mentioned the TA guide. So the TA guide will have all of these slides. If you ever want to reference it during your application process, and you need some help or you want to know what information you're looking for, that TA guide will have all of those things and the step-by-step that we went through today. So it is really helpful to just reference back to the TA guide because it'll help you know what you're needing for the application.
It's a great reminder. Thank you, Cassidy. Also, another reminder while we're waiting for questions, we will be posting this webinar within 7 to 10 business days. The recording of it will also be sending that out, so that will be provided to you. Next question is exactly on that. This recording will be posted. Yes, we will be getting the recording out for you. It takes about 7 to 10 business days to get the captioning and all of that done. All right, let's keep the questions coming. Any other questions? Will we have access to Cassidy directly? And again, if you do remember your question later, you can always email us at songbrown@hci.ca.gov. Give folks a minute or so to think of any other questions. Again, we have plenty of time today, so if you do have a question, this is the time to ask it. Is there anyone having trouble accessing the chat feature? Okay, question, when do we hear back?
So we will do a review of our applications, and we should be announcing awards February 2025. That date may or may not change, and we might have a better date in the coming future. So just check back on the Song Brown website. We do provide updates there if needed, but we are expecting to announce awards around February 2025.
All right, thank you. And let's see here. Next question, how do you propose we obtain the payer mix information from the practice sites? Is it okay if the practice site provides estimates?
So normally you can ask the practice sites directly if they know, or the training sites directly if they know their payer mix. If they have estimates, we don't require like proof or evidence. So if they only have estimates, that is perfectly fine with us, because we just want to know kind of where they are in terms of underserved areas. And so you can ask them. Oh, looks like Melissa has something to interject.
Yes, good morning. Hi, my name is Melissa Oman. I'm the program manager for Song Brown. I honestly would not recommend estimates because you are going to be scored on this, right? So we want the most correct information that we can get. So if the program itself, maybe the program director can reach out to these practice sites or these training sites, I'm sorry, and let them know that you are submitting an application, and a part of the application scoring criteria is the payer mix of their training site. Could they provide that to you? I think that question coming from the actual program director, somebody higher level than one of the students asking that question may give you better results. Thank you.
Thank you, Melissa, for that clarification. I did notice, Elizabeth Thomas, you raised your hand. Are you having trouble accessing the chat feature? If you are, you can go ahead and raise your hand again, and we'll give you a chance to let's see. I believe I can unmute you here. All right, you're unmuted. You should be able to ask a question. Are you there, Elizabeth? Up at the top, you should see an option to unmute your mic.
Got it. Now I saw it. Okay, thank you. Yeah, my question was back at the evaluation criteria, that last 1%, what was the last criteria there that was mentioned?
That would be the average payer mix of your training sites.
Okay, that was the average payer mix. Okay, thank you very much.
Mm-hmm.
Thank you, Elizabeth. All right, let's see, back to the chat. Next question, how do you propose we obtain the payer mix information from the practice sites? Is it okay? Did we ask that question? We did ask that question, didn't we?
Yes.
Yeah, that was the previous one. Okay. More questions. Anybody else have questions for Castany today? Anybody else having issues accessing the chat feature? You can raise your hand if you are having problems. You can do that at the top menu bar. You'll see a little hand icon with the words raise on it. You can raise your hand. We'll be able to answer your questions. Elizabeth's got another question. Let's go ahead and Elizabeth, you can go ahead and unmute yourself again.
Yeah, so in the early review, what feedback do you provide? Because the one time that I did early review, they only looked at, oh, did I put all my numbers in there correctly? They didn't provide any input on my program explanation. Is that pretty much what you do? Or do you provide some input on that?
I can take that question, Cassidy, if you don't mind. This is Melissa again. So what we do is we review every page of your application, and we make sure that, in addition to you've provided everything, we're just taking a look to see if the information makes sense. So, for example, what we've seen in the past is that programs will put in placeholder information, let's say in their graduate pages, so that they can move forward in the application. And then we see that they don't go back and change that information. So then we get some really odd names in the graduate for the graduates, or odd locations, odd addresses. We're getting apartments, apartment numbers, that kind of stuff. So we're looking at that. Pretty much what we look at is every page of your application that affects your scoring. So if we look at the payer mix page, let's say, and your payer mix, either you have like zero percentages or something like that, or we see that astronomically high payer mixes or something like that, we're going to flag that. And so in our email back to the programs, we're going to say, okay, we noticed these issues on each of these pages. You might want to take a look at them and verify that all this information is correct, and then resubmit your application. So that's what we do. We're really only looking at the pages that affect your scoring, could have an impact on your scoring.
Okay, thank you very much. That's helpful.
You're welcome.
And just to add some information, the pages that will impact your scoring is training site page, graduate data page, and student aggregate page. Those are the main scored pages on your application.
Say that again, if you would, please. Training site page.
Graduate data page and aggregate student data page.
Okay.
I just wanted to add something else. We are really going to start taking a look at the contract information page, because I will be honest with everybody on this call, that page, in addition to the STD 204, that has to be, filled out if you are granted an award, are causing us a lot of issues. So that is why Cassidy emphasized that you might want to ask your, I don't know if it's your accounting office or your fiscal office for a copy of the organization's W-9, so that you can make sure when you go to fill in the contract information page that you're using the same name that is reported to the IRS. Because what we're finding is that so many inconsistencies in the applications, and it's causing delays in people getting their payments, because there is an office at the state controller's there is an office within the state controller's office that actually compares your standard STD 204 against your IRS records, against the IRS records, Franchise Tax Board records, Secretary of State records. And if there's any deviations, they kick back your payment and they won't pay it until this gets resolved. So we are trying to handle this up front. So it's very important that people are filling in that contract information page correctly the first time. So that is another area that we will really start examining and providing feedback on during the early review process. Thank you.
All right, thank you, Melissa, for that valuable information. Great conversation, and we hope that this is all helping you guys be able to get your applications in more effectively. Any other questions today? Guys, another minute or so to think if there's any questions left. And again, wanted to remind you as well that there is a separate program for the licensed midwifery that will be coming in the next couple months. So keep your eye out for that if that's applicable to you. Next question. Is there still a spot? May I join the afternoon information session at 1:30 since I missed the early part of the presentation? Absolutely. Please join us. You can go ahead and join for that afternoon session, and we'll cover all of the same stuff, and we look forward to seeing you there. Thank you. All right, and that's a great great time to mention we do have another webinar coming up this afternoon for this. We will be covering the same information. That webinar does start today at, I believe it's 1:30. And so if you have a coworker that you think needs to be on this information, or you did miss a part of it, or if you think, man, I forgot to ask a question and I want another opportunity, go ahead and join us at 1:30. We'll be able to answer any questions that you have there. Do one last call for questions. Anybody else have anything they want to ask? Well, we have got a hand raised here. All right, I'm gonna go ahead and allow your mic. Rosanna, go ahead. Again, you can unmute your mic now. You'll see the option up at the top.
Yes, good morning. I came on late and I was planning to attend this afternoon, but would you please repeat the information you just said about midwifery program applications?
So this application that we are discussing right now is for the Certified Nurse Midwifery. The Licensed Midwifery Program application will be released October 24th at 3 p.m. And then webinars to follow. So if you are a licensed midwifery program, that application is for you on October 24th.
And there'll be a webinar separately for that as well?
Yes,
Okay,
yes. We will release that
much.
information. Yeah. So any updates for all of our Song Brown programs will be on the Song Brown website. So if there were the webinar dates and times will be posted there for that one as well.
Great, thank you.
Mm-hmm.
All right, great question. Thank you. All right, any other questions today? This is exactly why we have these webinars, is to give you guys a chance to answer questions or ask questions directly to our program staff. All right. Well, just one last reminder, you can find all of the links in the chat, scroll up, and you'll see it pinned there at the top. To the grant program, the guides, the TA guide, and the glossary, as well as the email that you'll use to contact us if you do have more questions. And Cassidy and Melissa, thank you so much for answering all those questions. And we appreciate everybody joining us today to learn more about the Song Brown Family Nurse Practitioner, Physician Assistant, and Certified Nurse Midwifery programs. We're excited to be able to offer it as a part of our health workforce development efforts at HCAI and are grateful for your participation with us today. We've got some resource slides for you here. Please follow us. You can always look on our website to see what's going on, as well as Facebook, LinkedIn, Twitter, and YouTube. We have resources. You can find our hashtags down at the bottom of the slide there. And then also, we really encourage you on the next slide to sign up to our newsletter. And this is a great way to stay up to date on things that are coming up. We will always have updates on webinars and programs opening and closing on this newsletter. So please go ahead and sign up to that if you haven't already. You're going to go and sign up for the health workforce portion on that sign up list. And there's a phone number if you do need to contact us, 916-326-3600. We really encourage you to look at our website to discover all the great resources that we have. As a reminder, the application cycle closes November 12th at 3 p.m. And once again, thank you so much for attending. And with that, we conclude today's webinar. Have a wonderful day. And just one quick correction, it is 916-326-3700, not 3600. All right, thank you. Have a good day.